high tech already plays a key role in surgery outcomes, and we are just getting started. A new device being used at the Swedish Neuroscience Institute is like GPS for brain surgery. Dr. Stephen Monteith, Director of Cerebrovascular Neurosurgery, is here to share more about the Microsoft HoloLens2. Thank you for joining us.
Thanks, good to be here.
So this HoloLens2, is this the device you're holding right here?
Yeah, so this is the headset. This is the HoloLens2 from Microsoft, and we use this device partnered with Monteith, which is a company which integrates the surgical navigation to the HoloLens.
It's incredible. So what exactly does it do? When you say GPS for the brain, is it showing you the pathways, the vascular system, all the things that help you get into where you need to go?
Yeah, that's pretty much it. So we can load in an MRI scan or a CT scan that a patient brings into the clinic, and then we can load that information into the device and create a holographic twin of that patient's pathology, their brain, their skull, everything. And then we can use that to help navigate the best way to get to the pathology in that patient's brain without causing any damage to surrounding tissue on the way in. So it's kind of a GPS for the brain.
It's incredible because I think that sometimes those of us who are not in the medical field and we think of anatomy, we think, oh, we're all the same, right? But everyone is completely different, isn't that right?
That's right. So this is really the ultimate in personalized medicine. We take a patient's individual scan. We can manipulate the anatomy in 3D. We can walk around it. We can get a really good understanding of where the trouble areas are for a tumor or tangled blood vessels, so we can avoid those areas when we do the surgery.
And you're using this right now at Swedish during neurosurgery?
That's right. So this is not a kind of pie-in-the-sky idea. This is being used every day with our team in vascular neurosurgery as well as brain tumor surgery, and we found it to be very helpful.
How has it been using this? How has it changed the way you look at doing the job you do every day? Is this a main tool that you use every day now?
Yeah, we use it every day. So we know that whether it's playing the piano or throwing a football, rehearsal of doing mechanical tasks helps improve outcomes.
Yeah.
And so we can practice doing the surgery. We can remove tissue like the bone, make a corridor virtually in the office. We can try different techniques. So we know when we get into the operating room, we've already done the surgery virtually in the office before we go to surgery.
It's really, I think, so interesting to think of how you're doing this. So instead of looking at something like a CT scan or an X-ray, you're virtually inside of it.
That's correct. So typically surgeons have to reconstruct those multiple slices, like a loaf of bread. You have slices on a CT scan or MRI, and then we create a volume, a three-dimensional volume inside our heads. But with this, we can create that virtual space and walk around it and really understand the anatomy and all the tissues around the pathology that we're dealing with.
Is Swedish the first to use this technology?
Yeah, we're one of the first, certainly first in the Northwest to be using this. We're very proud of our collaboration with Monteith and Microsoft. This is a really innovative project, and we found it to be very helpful for our patients.
I mean, this is incredible. This really is the cutting edge technology. How is the HoloLens and advances like this helping patients? I mean, are we seeing better outcomes?
Yeah, so we're obviously collecting data as we go, so we'll be publishing that once we have the data. But our initial impression is that it's optimizing our approaches to these surgeries. We can try out different techniques virtually before we do the actual procedure. So we're optimistic that it's going to show improved outcomes in the future.
Are you testing it now and you're releasing all this information to hospitals across the country? So you're doing a service for the whole nation.
Yeah, that's true. And one of the great things about Microsoft HoloLens is that we can use Microsoft Teams. So we can actually broadcast live these teaching experiences for neurosurgical trainees or other neurosurgeons who might want to see how we would do something or how they would do something. And so we can learn from each other, and that's one of the great collaborative components of this.
Using that technology to share so much knowledge. Wonderful. We've talked about the Swedish Foundation before here on this show. I understand they played a role on bringing this technology.
A huge role, and a shout out to Mr. Greg Enel, who made this happen for us. Obviously, it's a tough time in healthcare right now, but without the support of the foundation and generous donors who can see the vision that we see, we wouldn't be able to make this happen.
Wow. Well, we are incredibly grateful for the vision that you do see, and this is incredible. And thank you for sharing so much about it. It really is amazing what technology is doing for the healthcare industry. We appreciate your time.
Thanks so much. Thanks so much for being here. It was great.
Of course. So to learn more about the Swedish Neuroscience Institute, visit the website you see on your screen. All right, up next, we are diving into a topic that's a little hard to talk about, but it's really important. How the homeless crisis is impacting kids and how we can all help. Stick around.
This portion of New Day Northwest is sponsored by Providence Swedish.